Jessica DaMassa with WTF Health, and I am here at Bayer's G4A Accelerator launch in New York City. Joining me right now, I have Anna Rehnström. She is the head of digital marketing for the Nordics for Bayer. So talk to me a little bit about what is going on in the Nordics as far as healthcare is concerned. What's hot and what's not?
Well, quite a lot, I must say. I'm currently doing a visit in Silicon Valley, and I see a lot of parallel together with the Nordic region.
Okay.
I would say we're thriving a lot with small businesses, a lot of startups, and a lot in healthcare systems.
Okay.
And in the Baltics especially, we can see that they are kind of rising up because Baltics is a quite poor region, so they are very much into digital and very much into innovative solutions in the healthcare system.
All right, talk more about that. So what kinds of solutions are you finding coming out of the Baltics? Like, are they mostly applications to help with wellness, or is it something more like serious, like chronic disease? What are you seeing come out of there?
I would say the whole spectra, actually, but I think that easy applications to really get to market fast and then develop further is what we are seeing. We're also seeing that digitalization is the way to go. For example, in Baltics, we are 100% digitalized with medical healthcare records. So that's the one part of it that we go.
So what's that like? Because here in the States, like that is like nirvana fantasy for a lot of different people. So, I mean, what is that like, and what are you seeing come out of the system that works like that? Or is there really like an ownership of data? Is all of the AI hype and like the meaningful dissertations coming out of that, is that all true?
I would say that there is much easier ways now to work with the new technology, AI for example, because you have the basics, you have the consent, and you have the people with you. They are open for medical healthcare online and so on and so forth.
Do you feel like consumers are a little bit more ready to manage their own healthcare there than they are here in the States?
I would say so, and we are very used to receiving emails regarding personal data and a lot of things that actually can be taken care of online instead of paperwork and so on and so forth. So I'm very positive that this will come here, but it takes time, and you have tougher regulations than in Nordics. So I just pray that would change. I don't think so. Europe is also on the verge of getting there with a lot of regulations. It's about working with the regulations and trying to make the best of it there.
Is there anything from here that you're seeing in like your tour of Silicon Valley, and even like tonight here at this event, that you're like, oh wow, that's surprising. It's going to be a while before something like that hits Europe. Anything like that?
I would say people are very open, very driven, and I think we could see a lot more like that back home, and openness in terms of failing, in terms of, you know, you try a couple of times and nobody gets upset about that. I think we in Bayer needs to accept that, and I think also the countries in the Nordics needs to adopt that mentality.
Cool. So thank you so much for joining us. I love to hear, like, from a different country what your perspective is on both the U.S. healthcare system and then what's happening in your neck of the woods. So thank you so much for joining us.
Thank you very much.
Thanks. This is Jessica DaMassa with WTF Health. Thank you.